What if your fingernails were trying to warn you about kidney failure months before serious symptoms appear? It may sound surprising, but sometimes the body sends small warning signs long before a serious illness is discovered. And one of those signs may appear somewhere most people rarely think to look: their fingernails. Many older adults notice changes in their nails over time. Maybe the nails become pale, brittle, darker in color, or develop unusual lines. Most people simply assume it's a normal part of aging, but in some cases, those changes can be connected to something much more serious happening inside the body. As doctors often say, sometimes the body whispers before it screams. Imagine an older man sitting quietly in his living room, trimming his nails one evening. He notices the lower half of his nails looks unusually white, while the top appears darker than before. He shrugs it off and thinks, "I'm just getting older." Or perhaps a grandmother notices strange discoloration on several fingernails while washing dishes. She ignores it because she feels mostly fine, aside from being a little more tired lately. Weeks pass, then months. Eventually, the fatigue becomes harder to ignore. Swelling appears in the feet and ankles. Simple daily tasks begin to feel exhausting. What seemed like a harmless nail change may have actually been an early warning sign from the kidneys. Now, it's important not to panic. Not every nail change means kidney disease. There are many harmless reasons nails can look different, but certain patterns deserve attention, especially when they appear alongside other symptoms. As a doctor, I always tell my patients that the body leaves clues everywhere, including the fingernails. And today, we're going to talk about one specific fingernail pattern that has been linked to kidney problems and, in some cases, kidney failure. We'll explain what this nail pattern looks like, why kidney disease can affect the nails, and the other warning signs many people overlook. You'll also learn what to do if you notice these changes, when to see a doctor, and simple daily habits that may help protect your kidneys naturally as you age. Because sometimes, paying attention to a small change today can prevent a much bigger health problem tomorrow. So, what exactly is this fingernail pattern that doctors sometimes connect to kidney disease? It's a condition often called half and half nails, also known medically as Lindsay's nails. The name comes from the way the nail appears divided into two distinct sections. Usually, the bottom part of the nail, the area closest to the cuticle, becomes pale white or cloudy in color. Then, the top portion of the nail may appear reddish-brown, darker pink, or even slightly darker than normal. It almost looks as if the nail has been split into two halves. Some people describe it as looking like a fingernail dipped halfway into white paint. And importantly, this change usually doesn't appear on just one finger. It can show up on several fingernails at the same time. Now, many viewers may be wondering, what do fingernails have to do with the kidneys? Actually, much more than most people realize. Your kidneys work day and night to filter waste and excess fluid from your blood. They also help balance minerals, control blood pressure, and support healthy circulation throughout the body. But when the kidneys begin to weaken, waste products and toxins can slowly build up inside the bloodstream. At the same time, blood circulation may change. Protein levels can become unbalanced. Important minerals may shift out of their normal range. And over time, these internal changes can affect different parts of the body, including the skin, hair, and fingernails. That's why some people with kidney disease begin noticing unusual nail colors, texture changes, or slower nail growth long before they realize their kidneys are struggling. One of the frightening things about kidney disease is that it's often called a silent illness. In the early stages, many people feel completely normal. There may be no pain, no obvious symptoms, no warning alarms. Meanwhile, kidney function may slowly decline month after month without being noticed. That's why paying attention to subtle body changes can be so important. Now, half and half nails are not the only nail changes that may appear with kidney problems. Some people develop very pale nails that lose their healthy pink color. Others notice their nails becoming brittle, weak, or easy to crack. In some cases, dark streaks or unusual discoloration may appear. The nails may also become thicker than normal or grow more slowly over time. Of course, these changes can happen for many different reasons, including aging, vitamin deficiencies, circulation problems, or other medical conditions. But when several symptoms appear together, it's worth taking seriously. I remember a story about a retired school teacher in his late 60s. For months, he noticed that his nails looked strange. The lower part had become unusually pale, and he often felt tired during the day. But he blamed it on aging. He thought maybe he just needed more rest. Then his ankles began swelling slightly in the evenings. He started waking up several times during the night to urinate. Still, he ignored it. Finally, during a routine checkup, blood tests revealed that his kidney function had dropped significantly. Thankfully, the problem was caught before complete kidney failure occurred, and treatment helped slow the damage. Stories like this happen more often than many people realize. And that's why this topic matters. Now, it's very important to keep this balanced and realistic. Seeing this nail pattern does not automatically mean someone has kidney failure. Many harmless conditions can affect the nails, but certain changes, especially when combined with fatigue, swelling, or other symptoms, should never be ignored. Sometimes the body gives small warnings before a serious illness develops, and the sooner those warnings are recognized, the better the chances of protecting your health. Now for the good news. If low magnesium is contributing to your symptoms, there are several simple and natural ways to help support your body. And often, small daily changes can make a noticeable difference over time. Let's start with one of the most important areas: food. Many magnesium-rich foods are affordable, easy to find, and simple to include in everyday meals. Leafy greens like spinach are one of the best natural sources. Beans and lentils can also provide a healthy amount of magnesium while supporting digestion and heart health. Almonds are another excellent option. Even a small handful can be a satisfying snack that gives your body important nutrients. Pumpkin seeds are especially powerful. In fact, a small handful of pumpkin seeds contains more magnesium than many people realize. Avocados provide healthy fats along with magnesium. Bananas are easy on the stomach and convenient for older adults who may not feel like cooking every day. And yes, even a small amount of dark chocolate contains magnesium too, which is probably the healthiest excuse to enjoy a little chocolate now and then. The key is consistency. Your body benefits more from regular, healthy habits than from occasional extreme changes. And supporting magnesium levels doesn't have to feel complicated. Simple meals can help more than people expect. For example, a warm bowl of oatmeal topped with sliced bananas and almonds, a homemade spinach soup for lunch, or a simple banana smoothie with yogurt and a few seeds blended in. These small choices may gently nourish the body over time. But getting magnesium into your body is only part of the story. Your body also needs to absorb and use it properly. And certain daily habits can either help or make the problem worse. One important factor is hydration. Many older adults do not drink enough water during the day, especially if they are busy, taking medications, or trying to avoid frequent bathroom trips. But dehydration can affect muscle and nerve function, making symptoms feel worse. Too much sugar can also place stress on the body and may interfere with healthy mineral balance. Excess alcohol may lower magnesium levels over time as well. And poor sleep creates another cycle. When the body is exhausted, stressed, and inflamed, it becomes harder for the nervous system to stay calm and balanced. That's why healthy sleep is so important for recovery and healing. Because even healthy foods cannot fully help if the body is constantly overwhelmed and depleted. Now, many people eventually ask an important question: should I take a magnesium supplement? And for some individuals, supplements may indeed be helpful. Two commonly discussed forms are magnesium glycinate and magnesium citrate. Magnesium glycinate is often preferred for relaxation and sleep support because it tends to be gentle on the stomach. Magnesium citrate may help some people with constipation as well. But more is not always better. Taking large amounts without guidance can sometimes cause side effects like diarrhea, low blood pressure, or problems for people with certain medical conditions. That's why it's always important to speak with your healthcare provider before starting supplements, especially if you have kidney disease, heart conditions, or take prescription medications. The goal here is not to panic, and it's not about chasing miracle cures. It's about supporting your body wisely, paying attention to the signals it gives you, and giving yourself the nourishment and care your body may have been missing for a long time. Pay attention to persistent changes. Advice: keep track of odor changes, fatigue, appetite changes, night sweats. TTS-friendly phrase. Temporary changes happen. Persistent changes deserve attention. B. Lifestyle habits that help overall health. Simple, practical tips. Stay hydrated. Eat balanced meals. Reduce smoking and alcohol. Wear breathable fabrics. Maintain hygiene without obsessing. Emotional warmth. Small daily habits protect long-term health. C. Don't self-diagnose online. Gentle warning. Internet searches can create unnecessary fear. Encourage professional medical advice instead. Caring tone. Knowledge is powerful, but proper diagnosis belongs to healthcare professionals. So, what should you remember from today's video? Sometimes, the body whispers before it screams. A small symptom like eye twitching may seem unimportant at first, but in some cases, it can be the body's quiet way of signaling stress, exhaustion, or a possible magnesium imbalance. And while eye twitching is often harmless, it should not always be ignored, especially when it appears together with fatigue, muscle cramps, poor sleep, anxiety, or other ongoing symptoms. The important thing is to pay attention with wisdom, not fear, because magnesium plays a much bigger role in healthy aging than many people realize. It supports your muscles, your nerves, your sleep, your heart, and even your ability to feel calm and balanced throughout the day. And the good news is that small daily changes can often make a meaningful difference. Choosing nourishing foods, drinking enough water, getting better sleep, reducing stress, giving your body the care and support it may have been missing for years. These simple habits may help you sleep better, move more comfortably, think more clearly, and feel more like yourself again. Because you deserve to feel calm, rested, and healthy at every age. And remember, taking care of your health is not selfish. It's one of the greatest gifts you can give yourself and the people who love you. If this video helped you better understand your body, make sure to subscribe for more simple and practical health insights designed especially for healthy aging. And if you've experienced eye twitching, muscle cramps, or signs of low magnesium, share your experience in the comments below. Your story may help someone else feel less alone. You can also send this video to a parent, spouse, sibling, or friend who may be ignoring these warning signs without realizing it. And in our next video, we'll discuss another hidden nutrient deficiency that may quietly affect your energy, memory, and sleep after the age of 50. Take care of yourself, and I'll see you in the next video.